I would like to turn it over to our esteemed panelists here, Cynthia Scheideman-Miller and Debbie Voyles, who have both been doing work with us over the past few years. And they are very experienced in evaluating vendors, certainly in the telehealth space, as well as others. But these tips apply across the board, whether you're looking at a telehealth vendor or you're looking at even a provider vendor or a technology vendor in the straight technology space, IT space, et cetera. So let's talk vendor selection and vendor evaluation. Debbie, I'm going to turn it over to you.
Michelle, thank you very much. Cynthia goes first.
Yep, I was going to say, I'm going to turn it over to you, Cynthia. I apologize. That's on me.
That's okay. So one of the things that happened during COVID is a lot of people had to make very quick decisions on vendors for telehealth. And they really didn't get to think through the whole process. So we're kind of taking a step back, saying you have time to do it right. So let's talk about what are some of the right steps. And first things first is what we call the first slide. And basically, it's a step that a lot of people don't really think through. And it can save you a lot of time, money, heartache later on, frustrations if you go through this simple sort of process. And it seems simple, but people don't always look at what is the actual problem we're trying to solve. Because if you don't think through that, and it may be more than one, but that's important too, then there may be features that you don't think about or extra features that sound really fun, but are not what you need in the long run. So look at what problem are you really trying to solve that technology might help with. And that's why we have a couple examples there. Let's say just on the provider shortage though, how can telehealth address that? So it may be a total solution. Maybe your psychiatrist left your community and it's a really hard area to get somebody to come into. So maybe you have the patients come into the clinic and the psychiatrist never actually touches the clinic, but does all the services. Or it may be a hybrid. Maybe the provider's there one day a month and then the rest of the time it's telemedicine. Or sometimes it's, as we put, a stopgap service. Maybe the psychiatrist is left, but has agreed to cover over telehealth until you can get a replacement. So kind of look at what issues you're looking at, how the technology can help solve that, because that'll make a difference in the features that you look for. Also, look at the population to be served. So many of the telehealth or the technology solutions are for people that must have a college degree and make six figures. They're very complex, they're very wonderful, but they also assume that person or persons that are using it have very robust bandwidth that they can have telehealth over, that they're very knowledgeable, they love gadgets, you know, the whole thing. Where the truth is, a lot of people are limited in the broadband or the cell service or whatever they have access to, or they have a flip phone, or, you know, who are you trying to reach? What is the population? And that can make a big difference on how complex or how simple you go with your technology. And then finally, don't forget to develop an evaluation criteria. Now, this criteria helps you when your selection committee, when they start looking at the different vendors. And it also gives the vendor structure for their response to your request for proposals. And before we go even further, one thing I want to emphasize is at this stage, at the very beginning stage, you really need to be involving your clinical, your IT, your customer experience people. So from the very beginning, they're involved and they're hearing everything that you hear and see it. And then that will make their job and your job much easier down the way. Next slide. So one of the important things to do, now that you've figured out your problem, yes, technology can help, who the population is, now you make your list of needs. Now these are sort of, by far, this is not an inclusive list, but it's starting to get you kind of thinking. And we included a few that, I don't want to say the school of hard knocks, but perhaps I should say the experience has shown that there's some things that we hadn't thought about when we selected vendors that we ran into in the real world. And so the kind of the categories is ease of use. If it isn't easy, they won't use it. I don't care if that's staff, providers, patients, it has to be easy. We used to say 1 click is best, 2 clicks, they'll probably do it. 3 clicks, you're going to start losing people. 4 clicks, you wasted your money. It really has to be simple to use. The low bandwidth functionality, remember this doesn't have to be in a rural area, it's low bandwidth. It can be across your living room. A lot of these houses now that are new build, it's difficult getting a good connection. So you need to know, you want something that can function in multiple settings and capabilities, because not everybody that is going to get this service, whether it's a clinic, it could be a home, it could be a hospital, whatever you're going to, they all can be different in what they have. I worked with clinics that satellite was the only way they could get broadband. Well, you get a good wind going and that wasn't very good connection. And so you need to be thinking about that as you're looking at your vendors. Regulatory considerations. HIPAA, every vendor will say, yes, we're HIPAA compliant, every one of them. But what you need to make sure is in your list of what are you expecting. HIPAA is not a widget, it's a policy. And people kind of forget that. So make sure when you talk to your vendors, they outline exactly how they are HIPAA compliant, and that meets with your criteria. The next one looks weird. It's multiple parties. You'd think that was a technology consideration, being able to link in a third person. But actually, I'm using it as a regulatory because of the Department of Justice guidance that they issued on non-discrimination in telehealth. It's becoming more and more important to be able to include translators in your telehealth visit. And the video component is very important if they need sign language. So those are some, that's why I included that under regulatory. You still sometimes need the multiple parties like parents for permission for a child to be seen, that type of thing. But it's the biggest use, I think, is going to be in an interpretation or with interpreters. And then one thing that we heard repeatedly, oh, thank heavens that what we have will do this. And that's the ability to provide consent through the platform. Now, if they go into a clinic, that may not be a big issue, but if they're in the home setting or some other setting like that, then it becomes a very big issue. You need to have that consent form. It needs to be timely. It needs to be before the service. And if you have questions on that, Medicare has a nice little list of things that needs to be included in their consent form. And that's a good guide for all your services. And then finally, on technical considerations, the second one is one that has popped up several times, and that's, can they maintain audio if video fails? And they can start out, there's been many times I've heard people say, well, we started out with video, but as they got into it, for whatever reason, then the video was dropping. And if you had audio be able to maintain, then they could go ahead and either make arrangements to meet again, to reconnect, or they could finish the visit. And if you have that sudden, if the video stops working and the audio does as well, then you do this cat and mouse trying to catch up with each other. And it's very frustrating. And, you know, one bad experience sometimes will keep a patient from ever doing it again. So you want to make you want to look your best. You want to make the strongest connection that you can. And then, of course, technical support 24/7, 365. Make sure that's for the providers and the patients. If the patients are in their home, sometimes they'll offer one and then they kind of stumble when you say, well, I don't know about the patients, but the providers we got covered. Well, sometimes the patients need help too. So those are just some samples. There's a lot of other needs, but as you look through what you're going to want the vendor to do, be thinking about worst case scenarios. And then how important it is. It may not be that important to you to have technical support. You may have your own, group of people that will do it just fine. But for a smaller provider or provider group, that could be very important.
I think you make some excellent points here, Cynthia, that it's so important to create this list of criteria essentially, and then to really rank them for you, because one vendor may not be the end all be all for all of them. They may be stronger in one area versus another. And you need to determine is that important to you? Is that a priority for you? And you won't necessarily know that as a group unless you come together and prioritize that. One thing I wanted to add to your great list here, and maybe just reinforce, is the involvement of IT. And I'm glad that you said that. I see a lot of folks after the fact involve IT, and then they start to think about, oh, we have connectivity requirements from the IT department, or we have, we need to have a service level agreement, and they've never done a service level agreement from an IT perspective. If this is the operational department that's spearheading the vendor change or selection. And then one other thing that I've seen, and I'd ask you to comment on it, Cynthia, is the ability to define users within the system, either globally or locally. And also some of these vendors have the ability to record. So even though that may not have been defined as your criteria, they have this ability. And do you want that to be even an ability? So I don't know what your thoughts are on that. I'm interested to know.
On recording, I always say don't do it.
Yeah.
Because it's discoverable. And there's just, you have to maintain that as part of the medical record if you truly record it. And that can cause you some real problems down the way. And so I just say don't do it. And then on I'm trying to think, you had another.
From the user perspective, if you can define a user globally versus locally, sometimes that can be a challenge.
Yeah, so and that's funny, because when we talk about users, that's why I kind of mentioned earlier that it has to be easy to use for everybody. Thinks about the patient and the provider, but they don't think about the MA. They don't think about scheduling staff. They don't think about other people that may, a resident maybe, that may be in the system that's using this. And so you have to think of all the different people and scenarios that they might use it. It may just be a simple follow-up call. Here's how your labs are. You don't need to come in for it. We'll just tell you. Or it may be very complex and, hey, we really need to look down that throat. So then is that peripheral easy to use, that you may be using an otoscope or something to supplement? Is it easy to switch from your main screen to the picture of the throat that you're looking at? And so those are, it really depends on who's using it. And again, if you have a nurse that's having to juggle all these different peripherals, you better make it easy. Again, I harp on that a lot, but it's just, some people will use it just out of determination, but even they get burned out after a while if it gets too hard to use.
Absolutely. I think we're passing it over to Debbie now, right?
Mm-hmm. Yes.
So I just want to add to what you guys talked about making sure you get the IT involved early. I agree with that. And the opposite goes true if the IT is who's starting the conversation. So many times IT goes to a conference and sees something cool and they come back and say, we're going to do this. And they don't get the clinical people involved early enough to make sure that it meets what the clinical needs are. So it's a hand in foot, just as Cynthia said, you need to make sure you're getting all of your players and parties involved initially, coming together and sitting down and doing that. So, and as you're looking at these vendors, there's lots of things to think about. And one of them is, there are a lot of vendors out there and no two are the same. They all have different things that they're very good at. All of them have some limitation. So, one of the things that I've learned, and I know everybody else that's been in telehealth for a long time is experienced, there is not one vendor that will do everything that you want it to do. And so you have to understand that up front, that making the list, like Cynthia talked about what your priorities are, what are the key things that you have to have, is going to be critical, because you're not going to get one vendor that will do everything. So just make sure you understand that going into these. So you're going to want to talk to multiple vendors and meet with them and learn what they have to offer. Contract terms are huge. We're going to talk a little bit about more of that in a minute, but I want to make sure everybody understands, if they send you a contract, it's okay to go through and redline it and say, we don't agree with this, or we need to change this. You do not have to accept the status quo in a contract. So a lot of people that are new in this might get intimidated and say, well, here's their contract. This is what they're offering. If you don't like it, redline it, send it back. And if they won't work with you, then they're probably not the vendor that you want to work with. Are they going to require service level agreements? You need to know, are you going to own or lease the technology or the software, how that is? You need to understand the payment terms. There's the initial upfront cost. What are the ongoing costs? Is there a monthly cost? Things along those lines. And again, we're going to talk about that on the next slide when we get into a little bit more of the contract terms. We always recommend that you get at least three references that you can speak with, that are currently using the software, the technology, whatever it is that you're looking at. Talk to them, schedule that. That's it. That is huge. Most of them will be honest and tell you what's good, what they struggled with in an implementation, what they would have liked to have seen differently, or if they'd known something up front sooner, they could have made adjustments. So go into those conversations with asking them, if you had to do it over again, would you do it? Most of them will be honest with you. And then ask about where the challenges were, because that's really where you want to get at. Everything could be good, but there are going to be some challenges, and you need to know those up front. We recommend you have demos of what you're getting, and it's asking them to demo what you need. So looking back at the list, what is it you're trying to solve? What is it that you want that technology to do? That's what you want them to demo. Know that as you're asking for these demos, they cannot demo how their platform works in Epic or Cerner or anything like that because of contract regulations with Epic and Cerner. So they may have a EHR platform that is a standalone that they've created that they can show you how something works. They're not going to be able to show you how that works within Epic or Cerner. And that's where some of those conversations with the references can really play key is, are they integrated into Epic or Cerner or any other EHR? And how well was that integration? How well is it working? Go in it with trying to be unbiased, have open minds, but know what it is that you want to look at, what you want to ask before you get into those demos. And again, don't rush. Everybody rushed during COVID. When COVID hit, everybody was scrambling to try to get this up and going. And we saw so many people saying, okay, let's just throw this out there. And now they're coming back and saying, you know what, we really need to sit down and reevaluate because we cannot sustain what we're doing right now. So don't rush into this. This could have a big impact on providers, patients that care, and your overall system as a whole. So when you look at the contract terms to consider, again, that commitment to interoperability. I have maintained for a long time that if the government would have said when electronic EHRs were coming about and they were pushing all this money into making them available, if they would have added interoperability as a requirement at that point in time, we'd be a whole lot farther ahead than we are. Unfortunately, it didn't have that way. And it's still a work in progress in many areas. So, are they committed? Are they already there, or are they committed to getting that? And what is that going to look like? What would be entailed? What would the cost be involved? Who's going to do that? All of that should be a consideration in those contract terms. The cost for every component. So is it a one-time or is it an ongoing? Is it going to be something that you're going to have to pay by visit, by month, by provider? Those are things that you're going to want to know and have identified in that contract. We talked about the service level agreement, and Cynthia brought this up about, you need to make sure that you have something in place for not only the providers, the clinicians, but for the patients as well. And, what does that support call return look like? Is the support call in the United States, or do they outsource that overseas? Again, those could be key factors in what you're looking at. Is the support by text or phone call? What is their turnaround time to get back to you if you report an issue? And then you want to know what percentage of uptime for the platform is that you're looking at. And you want to make sure that it's at least a 96% uptime. Because if you run into an issue, and I know a lot of folks, when they were scrambling during COVID and selected some folks, they ran into a lot of issues that they were down as much as they were up because things were just being thrown together so quickly. So you want to know that. You want to ask those questions. Again, we talked about the pricing structure. As far as competitors, there are several vendors out there that not only provide technology and software, but they also have physicians that are providing the same services that you may be providing. So you may be competing against them. So that's something that you want to be cognizant of, is that are they going to compete against you for your population at any point in time? And then talking about the data storage, this was brought up a while ago. Are the visits recorded? Cynthia said, always say no. I mean, again, this is one of those things that if it's recorded, it needs to become part of that medical record, and the data storage and the amount of data storage requirements would just get to a level that most people could not maintain that level of data storage. If they are storing anything, where is it stored and who has access to it? I mean, you want to be able to report out visits, numbers, time, how much time you spend in visits, things like that. That could be reportable information that they're capturing, but you do not really want them to record the entire telehealth session because of the regulatory requirements that would go along with that.
Absolutely.
Michelle,
agree
do
with
you have
that.
anything you want to add to any of all that?
Yeah, I absolutely agree. I think the recording part is something that I always kind of touch on because it makes me nervous for all the reasons that both of you have already said. One of the things I wanted to note on here, and I'm glad you talked about service level agreements, because it is important to know just how much you're going to get in terms of tech support, training, implementation time. Is it going to be on site? Is it not? Is your support text, phone? I think that is really important, because then when you get to support and all you can do is put your information in a chat and just wait, that can be really frustrating. And then you didn't realize, kind of what you signed up for. On the percentage uptime, I think people need to be aware. It sounds really great when you say 96%, and that is kind of like the floor, because that's almost 14 days down. So you got to think about, what is your acceptable level of downtime, and is that really less than that in your organization? And they may be doing backups on the weekends. If your office is closed, that's great, and then that might be fine for 14 days down. But if you're 24/7 operation, you need to think about what your percentage uptime might be. One of the things that I think about when I think about a vendor evaluation is how it can help to level the playing field. So I had a client once tell me, and I repeat it often, that is, a vendor selection process can make sure that you don't cover up a bad system with a great salesperson, and vice versa, to reveal a great system from a bad salesperson, right? So if you don't want to have necessarily either one of those two things, you may have a bad system and a great salesperson, or a great system and a bad salesperson, and you didn't realize it. So you kind of start to have some opinions about it just because of the salesperson. So creating that list that you all talked about, defining the contract terms to consider. And you can really start to look. I'm glad you said exactly what you said, Debbie. Don't be intimidated. Look at what you're being offered and redline that and say, no, operationally, this doesn't work for us, or we don't need this. You might think, well, they just included it, so it's okay. But you start to look at your services and you don't need that. So, take that off. Have you found that when you've gone through these vendor selection processes, Debbie, that how many, when you look at the number of vendors that you have included potentially as part of the evaluation process, have you found that you've gotten down, when you get down to the bottom, what's the number that's a good sweet spot to kind of compare at the end?
Well, I've been fortunate that I've done this through several different health systems over the course of my career. And, we may start out with 15 vendors that we put out there and have them present an RFP for us to initially look at. And then we come back and we've even had them come in and do quick demos back when people travel. Now everything is virtual for those initial conversations, but have them come in and do a quick run through of what they've got. And then we've been able to narrow it down to, 3 to 5 at the most that we really want to do deep dives with. We want to have them come on site. We want to have that. We want to look them in the eye and see how they interact. And I can tell you how they interact can play just as much of a key role in helping decide what vendors that they are that you want to go with as not. They need to know their environment. They need to know who they're talking to, and they need to be able to adjust how they're presenting something to meet you and your environment and what your needs are. And the ones that do that well normally are, have those standouts, and they really do have a good product to look at. The ones that don't do that well, that come in and they're wearing their $1,000 suits and they're carrying high dollar things along those lines, they're not going to vote as well if they're going into a small rural community, because the people in the small rural community just can't relate to that. And they think, oh my gosh, I don't know that I could have a conversation with this person. And so, that's things that you can look at when you go through those demos. How well do they talk with you? Because they're the people that are going to provide the support moving forward.
That's a good point. The cultural fit certainly is important. And one thing you brought up that made me think about one demo series that I've done, where some of the vendors took the time to put my clients' logos in their system, took the time to use relevant examples for their patient base. If you're dealing with a pediatric base, don't talk to me about telestroke. Right. If those types of things, that makes a difference. It starts to plant seeds. So those are tips for the vendors, but it's also tips for providers that are evaluating these. That if they're not willing to take that time and make that extra effort up front, then that may be a red flag or a pink flag for you.
Right. I agree completely.
I think when we think about what will an evaluation process reveal, it's important, as you both said, to understand, will telehealth help solve this problem, and what is it that you want to do? And again, this could apply to any vendor. So will this technology, you can kind of place that term in there, solve the problem that we're looking to do, rather than, just kind of running after the squirrel. There's a lot of considerations here. I think one of the things that's most important is on the operational side. Is this going to be easy for your target population to use? I think a lot of folks, we haven't talked at all about cost, and we all know that that's part of it, right? That's just part of the deal when you get down to it. But when you start to think about your target population, if they're not going to accept the technology, then it's going to be really hard to get an ROI, no matter how cheap it is. So, or inexpensive, I guess is the words we should use there. But I'll turn it over to you, Debbie, to continue the checklist here. But I wanted to point out a few things, especially that, your target population and the cultural area.
The cost is right. I mean, everybody wants as much as they can for as little as they can. But sometimes just because you go with, you see the cheaper solution, it is not always the best when you get down to it. And that's really where studying what they have to offer, what those service level agreements are. And it may be very easy to use, but if it's down half the time, the ease of use is really going to affect that. And so you really, it's the whole package. And sometimes it may cost you a little bit more to go with something that will provide everything you're looking for. And many times it's going to be worth it in the long run, because this is going to be a big investment, and you want to make sure that you're not having to go through the same process in 3 years. One of the things that I want to make sure that everybody understands in the contract, and I didn't point this out well enough, is know what your termination get out clauses are. Because if you sign on the dotted line, you want to make sure if you get into this and they are not following through on their service level agreements, or they are not providing what you need to know how you can get out of that contract. And up front, before you ever sign it, that's another key thing. The one thing on this, that high reliability and tech support, but the bandwidth, Cynthia made the comment about it's not just a rural bandwidth issue. I live in urban area, and I still have bandwidth challenges sometimes when I'm trying to do things. And so it's, how much bandwidth will it really take to run that? And like Michelle said, can you keep moving it if the audio goes out, or if the video goes out, or you can still just do audio and continue on? So those are some of the key things that I think of as takeaways. Cynthia, what about you?
Yeah, just kind of summarize, I think, in another way of what you've both have said, and that is, this is a partnership. It isn't just you buy a pan and then you use it. It's an ongoing thing, and implementation, there's going to be snafus. There just is. I don't care how many they've done or you've done and how brilliant it is. Something is going to come up. And it really says to the relationship with them on how you solve those problems and get through that. And even if it's just they stuck with you until it was accomplished and then check back to make sure that it did solve the problem. So that very much kind of a partnership approach. And then the expectations, again, set them up front. That helps it for both for you, for your clinic staff, for your providers, as well as for the company. If you all know what, you all agree on the same expectations, it makes it a lot easier to work with later on. And so those are just kind of high points. We knew this wasn't going to be all exhaustive, but we did want to put some things out there from our experiences that we've run into, and then also I want to focus your mind, I guess, on the key things that you need to be thinking about.
Exactly. And I think it's easy to get caught into the shiny, big names that might be out there when there's some little known names that actually might be a better fit for you. And I would challenge, and I don't think you meant to say it this way, Debbie, or at least I heard it this way. It doesn't necessarily end up to be less expensive, even if the cost is higher, because you have so much more hidden cost that you find with some of the other things. So the integration piece is really important. One of the things that we have a couple of questions here in the chat, so I wanted to open those. And one of the comment and a potential, added on question, someone asked about or specified around, it's helpful to specify an acceptable format for data extraction at termination. Vendors will still do things like give you a database copy with no meaningful means of accessing the information and consider that acceptable, like a PDF. And that's such a good point. What are your thoughts on this? And I'll tip it up to you, Cynthia, and Debbie, you can add.
That would make me feel very uncomfortable if there was ever a breach or possibility of a breach. I want to make sure that I can drill down to the patient level, what provider saw them for what time. And as you said, a PDF just doesn't do it. And I don't want to see Dr. H saw 15 patients. That doesn't tell me what I need to know. I need to know what patients when, if they were cancellations, if there was a long wait time. I want to know what to be able to review it.
Well, the other thing too is you want to be able to take that prior data and put it in your system. So if you go with a different vendor, is there any way to incorporate the prior historical stuff into the new stuff so you have that continuity? So the PDF definitely is a challenge, and that's something that you need to look at in those contracts. Definitely is if there is a termination, how do you get access? How long will you have access? And what kind of access will everybody have? So good points there to point that out.
Excellent point. I've even had a client that had to pay the vendor additional monies to get their own data. So
Yeah.
it is important to, at that point, they know they're not going to be their vendor anymore. So there's no cooperation. So it's good to get, that's what a contract's for. Settle all those questions up front when things go bad. So
Definitely.
Debbie, Cynthia, this was great, super informational for the folks that are here listening live. Thank you for those that asked the questions. I think if either any of our folks have questions post webinar or are just interested in more information or want to connect, here's the email addresses for both Cynthia and Debbie. You can also connect with Blue Cirrus on LinkedIn, Twitter, or X, I guess it is now, and Facebook. You can also see us at conferences. We have quite a few coming up and speaking engagements that we're at, or you can just reach out. We're happy to talk and share any information that we have. And for those of you that have worked with us for some time, you know that is how we operate. We also have a number of references or resources, that you can utilize. Our Knowledge Tsunami is very helpful in terms of webinars that we've done previously, articles that we like to share, and also we've done previous webinars on evaluation of vendors. There's a lot of information right on our website that you can access. Also, the National Consortium of Telehealth Resource Centers, they do have some great information around vendors, especially the TTAC Technology Assessment Center. They actually are evaluating vendors on a regular basis, and they have given their summaries of those vendors on their website. It's not necessarily, again, an exhaustive list, and maybe not all of them are vendors that you would be interested in, but it would give you a more expansive list to look at as well and be able to take some of their advice around some of the challenges that both Cynthia and Debbie pointed out. And of course, the American Telemedicine Association also has some vendors that they recommend as well. You can check that out on their website. Thank you again. This webinar was recorded. So if you are interested in participating in the future or want a topic that you want us to cover, we're happy to do that. And you can always go back and listen to this at a later point and catch all those tips that Debbie and Cynthia shared. Cynthia, Debbie, thank you so much for sharing this information.